surgery.
For a change, we're going to talk about surgery. We always seem to be talking about other things, but never surgery, and it's something I really love.
Okay, and watch me go, really? Because when I think of podiatry, how little I know about what you do, I don't think about the fact that surgery.
Yeah, we do a lot of surgery. Obviously, it's not something you and I've talked about too much up to now. The nice thing for me as a practitioner is a lot of the times we can, with a very simple little surgical intervention, fix something that's left someone very challenged for a long period of time, left them immobilized or in great pain. And for some of our patients who have, for example, poorly controlled diabetes, it can be something that's actually life-threatening.
It's kind of strange because people are going to think who are watching, this guy suffers from everything. In my teen years, had the problem with ingrown toenails. Had a son who inherited the same situation. And it sounds, oh, what a big deal, like it's a toenail or something like that. As painful as you possibly can think of these things.
Okay, this is obviously canned, and I promise we didn't prepare this earlier, but that is actually the procedure we're going to talk about today. Ingrown toenails, everybody assumes ingrown toenails, and in fact, if you go on the internet, because everything's right there,
of course,
it's caused by tight shoes, it's caused by little boys incorrectly cutting their toenails and digging down the side, and in some cases, yes, short-term, acute little episodes are caused by that kind of stuff, but the vast majority of ingrown toenails are caused by the way you walk. And
really?
Yep.
Because it was funny because I was going to sit here and say, you mean to tell me that I can be born with it?
Well, your son obviously inherited the same delightful foot structure that you have, and we've talked at length before with your foot when you're walking. The crux of your issue is that your foot rolls in and it causes the big toe joint here to lock.
Okay.
So when you go to toe off, you have no choice but to rotate your foot and walk off on the side of the toe like so.
Mm-hmm.
So all of the pressure is being delivered right on the side of the nail here, and that pushes that toe across into its next door neighbor. Do that for a considerable number of years, and slowly but surely the nail plate becomes more and more and more incurved.
So are we teaching the big toe to grow the nail into the skin?
It's the actual pressure, the reactive pressure of the way you toe off, that's basically squashing the toe between the ground and the second toe. And slowly but surely that reforms and reshapes the nail.
And so you're talking about intervention to correct it, but I guess one of the other things you're looking at, that's fine, you can get rid of that problem, but then do you have to diagnose first what caused that problem?
And again, it's the first thing with any condition, we do a full thorough examination, one of which is we're going to have a look at you stand, or we may even have a look at you walk. And in most cases, where individuals come in with chronic ingrown toenails, where it just keeps happening and happening and happening, you go through various episodes, get them to stand, and pretty well without failure, their feet tend to roll in and pronate.
You got some great examples we're going to show when we come back from break. We're talking about intervention for foot problems. Dr. Mark Bradley is with us. We're going to be back. Thanks for joining us. It's a Tuesday, and you can't smell it. Studio's great. Sandy Richard is with us. We're going to do some cooking before the half hour is done inside Brand. Hey, we're talking about the, foot care, but specifically toe care this time around. Brantford Podiatry Associates is where you find Dr. Mark Bradley. We never get enough time because we can't get into everything we were talking about during the break. But I really want to get back to what you were talking about, ingrown toenails being the product of poor biomechanics.
Yep.
And that's a word I actually heard from the athletic therapist on the hockey team I work with. Was talking about poor biomechanics, and athletes can get these things. So right away, if somebody has got this problem, if the nails are ingrowing, if they're using the clippers and they're clipping them off and tearing it out trying to fix the problem, are they doing more harm than good?
Well, I mean, you need to do something to give yourself some short-term temporary relief. So by all means do that. But if you're having this consistently happening time and time again, and it's just challenging cutting down this, cutting around your nail to clear out this ingrown portion, get it fixed, because it's not going to get any better. It'll just get progressively worse. We've got a couple of
I was going to say 1,000 words
examples
here because we got some pictures you brought along that give somebody
which show
an
it pretty
idea what we're
clearly.
looking
And sometimes even quite mild, where the nail just has a lot
This
of
is mild?
Well, this is where we've now gotten to the point where someone's tried to clip their nail and they've got a little spicule left in the side and it's actually punctured the flesh.
talk about the fact that, again, if somebody clips that nail and yanks it, they're probably getting into the nail bed and they open up room for infection?
If you can't cut right to the very edge of the nail and you tear the last piece off, it always leaves like this jagged tooth that punctures the flesh.
And again, I want to mention that I'm trying to get it clear. If I clip it and kind of yank it across, it'd harm the skin as well.
Well, I can guarantee you'll leave that little jagged tooth, and yeah, that'll rub against the flesh, and the flesh is being pushed up because of the way we're functioning against now that new raw edge of the nail.
Okay, so we're looking at this one, and what are we
so
looking at
again,
here?
once the nail has been pushed into the flesh for a while, the skin takes great offense to this, and it starts to proliferate, and it grows, and it expands, and it's a push me, pull me. You know, one expands further, and the nail becomes more and more ingrown, and there's a constant stream of pathogens going into the bloodstream. So, you know, for someone, for example, that's diabetic, that's a big challenge.
Right.
You know, and suddenly they can't control the blood sugar. It's up and down. It's completely out of control. The last little image is, again, shows you how curved and how involuted these can get.
Now, I when I saw that, I went, oh, come on. Look, I mean, literally, somebody can be walking around with that?
And painless.
Really?
It's amazing. Sometimes the most frightening looking examples are the ones that don't cause them a great deal of discomfort. I mean, clearly, you leave that for long enough and it is going to be problematic. But that can be fixed, and we can reshape that with a very, very simple little procedure that's painless, and have them back to work the next day. Now, sometimes there are other types.
Is this suturing a nail?
Yeah, this is a very common procedure that's sometimes done. This is not how we do it, where they actually surgically try to remove the cells from which the nail would regrow.
Right.
Disadvantage with that is it can be exquisitely painful.
Right.
And in about 75% of cases, it grows back, and forgive the expression, but it looks like a dog's dinner afterwards. It's awful.
When my son went through it and they removed the whole nail, he ended up with, right in the middle of his big toes, he had this little thing that seemed to be growing, which was funny because it didn't come out of the nail bed.
Yeah, and unfortunately, it doesn't need to be like that.
Right.
I mean, typically, you know, we'll tell patients, you know, once we've done the procedure that day, you know, go home, relax, get your foot up for the rest of the day, and you're going to be doing some saltwater soaks for 10 to 14 days afterwards. But you can go to work the next day. You know, just be careful, no kicking footballs.
So going back to where we started this little discussion with, even if I get some home relief and I get the pain gone, I may have fixed the ingrown toenail, but I may not have fixed the underlying problem.
No. So, and a lot of the times, once we've got the surgical procedure done, we'll say, okay, you know, that's great. You're guaranteed this is never going to come back again. If it comes back, come back, see me. I'll look after it for you. But do yourself a favor, whether with us or with somebody else, go and treat the mechanical instability that caused that problem, because it will have subsequent effects down the road.
You know, and before we let you get out of here, I want to put you on the spot. I want to ask, percentage-wise, the number of people are probably walking around and walking improperly.
Again, yes, a lot of people are, and it's just been heightened, as I said before, by the fact we now live in this ghastly world that's completely flat and covered by the hardest possible materials we can find.
Super. Listen, we'll welcome you back again in the future, and thanks for coming in today.
Pleasure.
Dr. Mark Bradley, Brantford Podiatry Associates. Coming up next, Sandy Richard, we're going to talk cooking and cookbook when we return.